Okay, we're gonna introduce the next speaker, Dr. Stefano Sansevero from Italy, and he's gonna talk about 11 years experience in Trough and the periorbital region. Thank you.
The periorbital region, due to its anatomical complexity and high aesthetic visibility, plays a key role in emotional expression and is one of the first facial areas to show signs of aging. The aim of this study is to highlight the strong regenerative potential of some latest generation injectables, and it is possible to slow down the progression and correct aging signs at this level without surgery, at least in a not too advanced stage, though I also treated some advanced and surgical stages. My consecutive practice from 2014 to 2025 focuses on tear trough and palpebromalar groove with a progressive evolution of technique and product selection. The simplest classifications regarding this area distinguishes between allowing of tear trough only, tear trough and palpebromalar groove, and also presence of cheek volume deficiency and sagging. I've treated the tear trough in almost all cases. When necessary, I perform the preparation of the zygomatic area and cheek to restore volume and three-dimensionality and to give support. Core treatment of tear trough and palpebromalar groove always involved semi-cross-linked HA filler, 15 mg per milliliter plus dermorestructuring complex in 2 stages, spaced 2 to 4 weeks apart, either alone or in combination with non-cross-linked HA plus DRC to improve the skin quality, preserved network technology filler HA 15 mg per milliliter for superficial periorbital wrinkles, PNT filler HA 23 mg per milliliter to restore the superficial fat, and static cross-linked filler HA 25 mg per milliliter for the deep fat and to support the zygomatic ligament. The abbreviations for the products: I generally prefer using needle when inject the tear trough more superficially, while I use cannula for deep injections in tear trough down to the bone and in the zygomatic area and cheek. Always follow anatomically safe vectors. All the injections were performed with a multi-layer technique, very slowly, and with small quantities of product, microboluses or drops. I consecutively treated 126 patients. 95% of patients received their first TT treatment. Adverse events included bruising in 30% of cases, 2 long-term product accumulation resolved with hyaluronidase, no major side effects reported. Starting from the simplest cases, 37-year-old woman with TT and PMG deformity who received the core treatment with semi-cross-link in 2 stages, 1 month apart, showing a fairly stable result at the 8-month follow-up. 43-year-old woman with severe TT and PMG deformity, volume loss, and under-eye bags, who received the core treatment in 2 stages, static 25, at 8-month results were positive. She later received another semi-cross-linked PNT 23 and 15, allowing to a good volume restoration and cheek sagging correction and reduction of under-eye bags at the 2-year follow-up. 29-year-old patient treated in 4 stages with the semi-cross-linked, resulting in good volume, in good infraorbital allow restoration at 18-month follow-up. Then treated again with semi-cross-linked in multiple stages over 4 years and a half, led to a stable result at the 6-year follow-up, maintained without retouching at the 7-year mark. 77-year-old man, surgical case, treated in 2 steps. First step, semi-cross-link, static 25. 3 months, there is an improvement. semi-cross-link again, PNT23, and the non-cross-link cycle, resulting in good volume restoration and reduced under-eye bags at the 6-month follow-up. 46-year woman with very evident TT and PMG deformity, cheek sagging, core treatment with semi-cross-link, and then a non-cross-link cycle, and multiple nasolabial folds injections plus Botox over 6 months, showing positive outcomes at 3 and 7 months. 48-year-old man with very evident infraorbital allow and cheek sagging, treated with semi-cross-link, static 25, with a good correction of the tear trough and palpemolar groove and volume restoration at 1 month. Then a cycle of non-cross-link, semi-cross-link. At 10 months, the results were stable. And a good stability of the result at 20-month follow-up. And the 2-year follow-up. This is a full-face case. I am sorry that I cannot present this case in full. 48-year-old woman with severe tear trough and palpemolar groove deformity and volume loss. I started treating the volume loss. After 3 months, I performed the core treatment in 2 stages. Then multiple sessions over 1 year and a half, with a good correction of tear trough and good volume restoration at a 20-month follow-up. And then maintenance treatments to preserve results and the 2-year follow-up, always small quantities of product. 39-year-old patient with very evident tear trough and cheek sagging, core treatment, static 25, then multiple sessions of semi-cross-linked, and the result at 1 month and 60 months, pretty good. It's important not to overdo because there is a risk of accumulation, so it's important to give the products time to work by hydrating and biostimulating the tissues. Finally, positive outcomes at 20 months with volume restoration and tear trough and palpemolar groove correction. Maintenance treatments and good stability of the result at the 3-year follow-up. 3/4 view. Finally, I present 2 of my recent cases. 69-year-old woman who received the core treatment with semi-cross-link in 2 stages, showing results at 1 month. Then another session of semi-cross-link. At 3 months, the improvement was clear. Finally, maintenance over 9 months ensure the good stability of the result at the 20-month follow-up. And the 3/4 view. The last is more a don't try at home case. Is the most challenging case I have treated. Is a surgical case, but the patient requested an aesthetic improvement of her periorbital region without resorting to surgery, so I aim to help her. Is a 67-year-old woman with enormous fat bags, treated in 3 times with semi-cross-link. 0.7, after 1 month, 0.6, after another month, 0.7 again. At 3-month follow-up, there is a significant reduction in periorbital fat pads. The 3/4 view, it's a recent case with only a 3-month follow-up. Of course, I look forward to reviewing the outcome in 3 months and beyond. It's a treatment that must be carried out à la demande and modulated depending on the patient response and its evolution over time. In conclusion, my treatment strategy consisted of 4 main steps. Prepare, support, refine, and regenerate, allowing to rejuvenate and prevent aging in the periorbital region with long-lasting result. Thank you very much for your attention.
Thank you very much. Very impressive results. Last